The next time any liberal tells you they want Medicare for all, or free healthcare, or a public option, whatever name they use to describe a government-run healthcare system, the next time liberals say that government-run healthcare is the best and fairest way to make sure everybody has access to the healthcare they need, you show them these two tweets. First, Hollywood actress turned political activist Alyssa Milano tweets, and I quote, "If you are a Republican elected official who called this pandemic a hoax, refused to wear a mask, or said that wearing a mask impeded your freedom, you should be at the back of the line for the vaccine." End quote. In a nutshell, this is why government-run healthcare is dangerous, because leftists want to deny you healthcare if you disagree with them, or if they don't like your opinions. Is that not terrifying to think that these same leftists in control of all your healthcare, doling out cancer screenings and chemotherapy, dialysis and antibiotics and pap smears and hip replacements and surgery based on your politics? Then we have leftist actor George Takei, who tweeted, and I quote, "There are very, very few instances of known allergic reactions to the COVID-19 vaccine, but Marco Rubio has always thought of himself as 1 in a million, so there's still hope." End quote. Again, these same leftists who hope conservatives suffer severe adverse medical events from the COVID vaccine want to control all of your healthcare. Can you imagine? Not only would we face rationing and wait times due to the cost of government-run healthcare, somebody else would be in charge of deciding if you deserve treatment. Apparently not just from a medical standpoint, but from an ideological standpoint as well. In fact, this isn't hypothetical. We're already seeing ideology creep into the distribution of the COVID-19 vaccine. You'd think older people, especially in nursing homes, would be prioritized, offered the vaccine first, right? Because older people in nursing homes have the highest fatality rate for COVID-19, and long-term care facilities are hotbeds of transmission of the virus. But nope. Healthcare workers, young, healthy healthcare workers, are getting the vaccine before vulnerable populations. Why? Because, according to a University of Pennsylvania doctor, healthcare workers are more racially diverse than the population of people in nursing homes, who tend to be white. In other words, it's not scientific to give the vaccine to healthcare workers first. No. It's ideological and it's political. So if you're mad that healthy young people are getting the COVID vaccine before nursing home residents, imagine government in control of all healthcare, picking and choosing the so-called important people who deserve care and the non-important people who must wait in line.